Welcome back to Recharge. Recently, we recorded a podcast episode on our Movement is Medicine podcast. Check that out if you haven't been listening. But we talked about back pain, more specifically low back pain. And I know on this channel we've done several videos on low back pain, but I think it's important to revisit it because it's so incredibly common. Now, on this podcast episode, we talk specifically about an acute flare-up or a flare-up where back pain just kind of hits you out of nowhere. And we talked about different causes and reasons. But on this video, I want to go through a little bit of a time frame for dealing with back pain like that. More specifically, I want to give you some actionables, some strategies, some movements you can do during this period. So let's break this period down into three phases. Phase one, the acute phase, or the calm shit down phase, where you want to spend the first 0 to 14 days bringing your nervous system down. And during this phase, it's your body's going through an inflammatory stage. Your body's dealing with the current issue by dealing with the irritation through the inflammatory process. As an analogy or an example, think about it as spraining your ankle. When you roll your ankle, it gets swollen and you're limping. And this is kind of parallel to that with your back. So you're essentially limping, and you're going to be limping for a couple weeks. It's just the limp looks different when it's dealing with your back pain or dealing with your back. So you'll see some examples in a little bit of some movements you can do and some strategies you can utilize for that. Then the second phase, which is 14 days or 15 days to about a month. So let's call it 14 to 30 days. And that's beginning what's called the subacute phase as you start to transition beyond the initial inflammatory response. And that is when your body starts to normalize again. And this is a critical phase because this is your opportunity to teach your brain, to teach your nervous system, and to teach your body that it's okay to start doing certain movements. And when you don't have a strategy, or when you're dealing with back pain without a physical therapist or without a team like at Recharge, then it can be pretty daunting because you really have no idea what is normal, what is okay, and you're dealing with a lot of scary sensations and pain. So we'll show you some of things you can do in that subacute phase. And if you don't feel comfortable, certainly find a physical therapist, healthcare professional in your area that you can trust. Physical therapists are great for dealing with back pain like this. And then we have a chronic phase, which is oftentimes your tissues can be healed up, but pain still persists. So this is also called persistent pain. And in this area, this is a slightly different beast of dealing with pain, and we'll have a separate video dealing with chronic pain or persistent pain, particularly low back pain. So moving forward, let's get into the actionables. Let's look at the first 0 to 14 days and some movements you can do. Let's get into the gym. All right, now out in the gym area, let's go through some of the functional or things you could actually do once you are in back pain. And it doesn't feel like a lot, especially if you're just had that jolt of pain, oftentimes described as a hot poker stabbing you. Feel like your breath gets knocked out of you. If you listen to the podcast that I referenced earlier, Corey was talking about he was standing in line, just took a step and just couldn't move. So really the first step, the first thing to do is take a breath. So if you were like me, for instance, putting pants on and you hit that jolt, the first step is just stack your rib cage and see where you are. Give yourself a pause, take a couple minutes, and just breathe. Because probably the next step you take is going to be another jolt of unpleasantness, to put it lightly. So if that happened, again, one of the things you should already be taking away from this is it's normal. It doesn't feel great by any means, but it is normal to have what feels like the most intense pain of your life, unless you gave birth. If you gave birth and you heard me say that, second most intense pain of your life. So take a breath, process where you are, and then get somewhere where you can just sit and take a few more breaths sitting down, right? Right now, we need to unload that spine a little bit and everything around it, more importantly, that's starting to do what it's supposed to do, which is guard. This is where your muscles go into spasm. This is where the entire environment around whatever that irritation was, most likely that preliminary disc irritation or herniation, everything around it is starting to get a little unhappy, but they're doing what they're supposed to, which is protect. So find a seat, go sit down. It might be steps like that. That's okay. Some of you might need to put your hands on your knees and walk like that. This, by pushing down into your thighs, will create an unloading feeling in the spine. That's okay too. Do that, find a place to sit, and then we'll move on to some more low-level things that you can do during this 0 to 14-day phase of dealing with acute low back pain. All right, so let's say you are an hour in, you realize what's happened. It sucks by every measurable that you can imagine. It doesn't feel good to have this pain. And the unfortunate scenario is you have about 10 to 14 days that your inflammatory process is going to be dealing with this. So there's going to be various levels of jolts, of shocks, of pain. But there are things you can do to help your body kind of move this inflammatory process along. More importantly, just calm shit down. Just have some moments of relaxation. And that's what we're going to show you now. And the first thing to do here is figure out which movement pattern doesn't bother you or doesn't jolt your back as much. And it comes down to usually one of two movement patterns, and it's called flexion or extension. Start very simply. Start to try to bend over and see what that feels like, and then come up and try to bend backwards. Likelihood is you're not going to get too far in any one direction, but there is going to be one. So if you start to move back and you feel that jab, then extension is not the ideal movement pattern yet. If you move forward and you feel a tightness, but you start to feel a sensation of relief, then flexion is going to be our first pattern to establish some level of calmness for your system. And so we're going to show you both. We're going to show you some flexion-based movements you can do, some extension-based movements you can do. Here's the kicker, though. As your body moves beyond the inflammatory stage, all movement patterns are good and important to do, right? There's no such thing as good or bad movement patterns. Right now in this stage, though, there's one movement pattern that's going to be a little bit more aggressive to your system. It doesn't make it bad or good. It just makes it that aggressive. And we want to stay away from that as your body deals with inflammation. So let's take a look at some flexion-based movements and some extension-based movements that you can do while in this acute 0 to 14-day stage. The first step, let's go through flexion. And Corey is going to demonstrate some simple flexion exercises you can do. They're not going to seem simple when you're dealing with this pain. And if you've dealt with it, you know how even complicated this might seem. So the first thing is, let's take away as much threat as possible from your nervous system. And we're going to do that by sitting down. All right, when you're standing, it's a little bit more work. So let's sit down. And that's going to start by putting your hands on your knees, sliding your hands down your thighs until you can put your hand on whatever you're sitting on and get into that seated position, which is going to take some load off your back. Now, from here, again, simple movements can be jolting. So get situated, take a few deep breaths. And when you take a deep breath, it should be your belly pushing out as you breathe in. So take a breath in and belly comes out. Take a breath in and belly comes out. Now, from here, it's simple pelvic positioning. So you're going to roll back and come forward. Now, coming forward might get a little spicy, so do this nice and slow. Start with very small movements. Roll your pelvis back and roll it forward. Roll it back, roll it forward. So that's little pelvic tilts is a good way to start. Another thing you can do is, let's say, and again, this is very common, you're going to feel pain in somewhere around your glute area or your hip area. That's called referral. So a lot of times lower low back or lower lumbar disc herniations will radiate down into butt area. So let's say your right side is hurting. You can put your right leg over your left leg. So kind of cross your legs. And again, see how that feels. That puts it further into a flexion position. And then you could gently pull your knee up towards your opposite shoulder. So right knee goes to left shoulder until you feel some tension on that glute. So this is going to feel like a stretch, but what it's also doing is creating more flexion for your hip and your spine as well. So you could do a couple things. You can pull it to your shoulder, you can hold that, or you can pull it, hold it, and then rotate or turn your left shoulder into your right knee. And see what that feels like. And you could try the other way as well. You could turn away from that knee and see what that feels like. Again, you're doing these nice and slow, and this is a good way to start to initiate that motion. So this is very easy to do in a seated position. Just get some movement into you. The next thing we're going to show you is going a little bit more directly at the nervous system, and this is called a nerve glide or nerve flossing. There's a lot of nerve terminology for this, but what you're essentially doing is you're going to put some tension on the sciatic nerve, which runs around the posterior chain. So Corey's going to extend his leg out, first of all, as much as it can go, and most times even that is going to be enough to feel tension and some sensation in your back. Now, from here, you can do a couple things. Number one is you can lower your chin to your chest, and that's going to put a good bit of tension on that nerve and the posterior chain. So do this nice and slow and work that. If you already feel your symptoms or you feel pull on the back of your leg, just work your head. Go down and up, down and up. The goal here is after several repetitions, let's call it 10 to 15, you should feel whatever you're feeling get less intense. If you're doing this and it's getting more intense, then we have to rethink what you're doing, or it might be too soon to do something like this. The other thing you can do is keep your head up and move your ankle. So move your ankle up and down while maintaining consistent head positioning and see how that feels. And then the third thing you can do is keep your head and ankle the same and just straighten your knee and bend your knee. And see how that feels. All of that does very similar things. It just does it at different starting points from different ends of your body. So you can play around with that. That typically does a good job of starting to calm your nervous system down and desensitizing it as you're going through this inflammatory process. All right. Once you feel more comfortable getting down to the ground, and by comfortable, I mean you actually feel like you can get back up. That's kind of important. So don't get down on the ground unless you are relatively confident that you can get back up or at least scream at somebody to come get you. So from here, just being in this position already, if you can see with Corey's hips bent and knees up, that's already a flexed position. So for most people, just laying in this position, lying in this position, chickens lay eggs, humans lie down. So lying in this position is, for most people, relieving, and because it takes a little stress off the spine. What you can further do is take the knee of the side that's involved. So let's say the right side is involved, and you can bring that in towards you. And once it's in there, you can kind of imagine like you're churning some butter. If you were in old Puritan days, you're going to move it around a little bit. So you might feel some stretch sensations. You might feel all kinds of fun things in there as you're doing that, but it should still feel relatively good, meaning not jolting you. Again, once in a while, you might feel a little jolt because that's what your system is going to do right now, but it's still a pretty good way to calm things down initially. And yes, you can do the other leg as well. It's not just on this one side. So you can move around and see what it feels like on both sides. Then you can bring both knees up as well and hold that. Take a deep breath. Now, if it's too much strain to lift your feet off the ground to even bring your knees in, which can be for some people because you have to activate your low back muscles to bring your knees up, you can bring a towel with you when you lie down and wrap that towel behind your thighs and hold it, and then use that towel to bring you up. And that will help as well. So that's, especially if you're super, super irritated at that point, you can do that. Okay. The other thing you can do is, and this is usually a few days in, is bring your knees up towards your chest and put your hands on the front of your thighs and then try to push your thighs away, but don't let them move. So you start creating what's called a little bit of an isometric contraction. Start to get those muscles activated gently because there's no motion involved aside from the static positioning. And that starts to get your muscles working a little bit more and usually feels pretty good for most people. And you could do several repetitions of that, similar to the nerve glides that we talked about earlier. This should start to feel better and better the more and more of these you do. Last one we're going to show you in this flexion position, or at least lying down position, we'll show you a few more flexion, is we're going to add some rotation or some twisting into it. Now, I like to do whenever I have a flare up is slide my hand underneath like Corey does, and that puts a little pressure on the muscles, which gives it a different sensory feedback. So it just tells my nervous system that there's something there, and it helps, at least in my experience, calm things down a little bit. So I like to go a bit higher where Corey is, so like about a little bit lower than upper back, not quite in the low back, so right in that mid back area. And then I kind of push down onto that hand. Now, again, granted, you need to have the ability to do this with your shoulders. If you can't, grab a towel, put a towel there. And then you're going to gently rotate your knees towards and away from that arm. And you should feel your body, your muscles pushing down into your hand. So as you rotate towards, you're going to feel more pressure on the hand, meaning if you have your left arm underneath of you, you're going to feel it more as you rotate to the left, and you're going to feel it a little bit less as you rotate to the right. My typical rule of thumb when I'm doing this is if I'm rolling away, I try to roll until I start to feel my hand pull away or my body pull away from my hand. That's when I stop, because I know if I go too much further than that, chances are it's going to grab me some. So I kind of rotate back and forth, back and forth. Now remember, this is usually in the first 0 to 14 days, particularly low-level things like this, or even earlier than that, first 0 to 5 days when you're really, really irritable. So this is a great way just to give yourself some relief. Just start that process as your body does what it's supposed to, which is have an inflammatory process. Alrighty, now we're going to show you some extension-based movements or arching back. We're going to start by lying on your belly. So by simply lying on your belly, that naturally puts your body into an extended position. As you can tell, Corey's fairly leveled out and straight. So this is a good way to start. And you can do this on the floor. You can do this on your bed, your couch, wherever you can find a place to lie down on. Now, preference for firmness of the ground really depends on you. Some people like really firm things. Some people like a little bit softer. So it depends on what your body is kind of telling you in that moment. So start there and start with, shocker here, breath work. So Corey's going to take a deep breath and push that belly into the ground. So what you should feel, and you can see if you take a look at Corey's low back, as he's taking a deep breath in, his belly is pressing into the ground and pushing his back upward. This is a great place to start by moving things from the inside out. By taking those deep breaths, you're moving your spine, you're moving all the muscles from the inside by moving your diaphragm. So this is a great one to start, especially early on, to move things around. Then from here, we're going to progress to what's called a prone press up, where you're going to slide your elbows inward and push up on your elbows nice and gently. And just start at that. Don't push your hands into the ground yet. We're just starting very gently to see what your limits are. Just moving that back away, the chest away from the ground, back goes up. You could also tuck your chin here and really get that upper back involved as well. As this gets easier and easier, again, doing several repetitions, you can progress to bending the leg of the side that's involved. So in Corey's instance, is the right side. We'll stay consistent with that. Bring that right leg up, find a comfortable position, and then do that again with the side up that you were doing. And this is a great way just to calm that system down early on. And then from there, you could obviously progress to extending your arms, being up on your arms as you do more and more. This is one of great warm-up that we utilize a lot of recharge for our members before workouts. Again, priming that system, especially if there's going to be a lot of extension-based movements in the workout. It's a great way to prime. All right, from there, we're going to move into a quadruped position or all fours position. So from here, you can do a couple things. Most of them you probably know or heard of. You can do what's called a cat camel, where you arch your back and bring your head down and go the other way. Good. You can bring the leg that is involved out, so straight out to the side of you. And then you can rock forward and rock back a little bit. So that maintains a flexion extension position. So it gives you a full range. Good. You can bring your opposite arm up. So if your right side is involved, you're going to bring your left arm up and back down, up and back down. So you're introducing more extension into the system without directly involving the low back. That's another great one. And then once the stabbing, shocking type symptoms subside, usually a week or two in, then you can start introducing some strength-based movements. So you could bring that right knee away from you, called hip abduction, and back, or fire hydrants. They have a lot of lovely names for this one. You could also go straight back into what's called hip extension and move that. Another one I'm going to show you that I really like that doesn't get utilized a lot is called log rolling. So Corey's going to roll over on his back again. And from this position, he's going to straighten out his left leg. And he's going to bring his right leg over his left. And it's going to roll. And he's going to pause there for a sec. And you can see his left leg is, or his right leg is across. And he's got some rotation already through his trunk. But his right shoulder is still down. So you want to maintain this tension so the right leg comes across and the shoulder doesn't come over until it absolutely has to. So it goes last. So think of it as steps in a chain. First the leg, then the hip, then the back, then the chest, then the shoulder. He rolls over and then he goes on his belly. And then he's going to go the opposite way, starting with the shoulder. So his right shoulder is going to go back and opposite of what he just did. Now, if it's too much to do all that, just start by breaking that roll down a little bit. Do one piece at a time and then back if that's where it starts to spasm or bite you. This is a great way to gradually, over days or a couple weeks, start to introduce full pain-free range of motion into your entire system and your entire spine. It's one of my favorites, something that I do every time I have a bit of a back flare-up. All right, so we've gone through sagittal plane, forward and back, flexion extension. We did some rotation, which is the transverse plane. But we also have a third plane of movement called the frontal plane, which is side to side. And this one gets ignored a good bit. So rotation gets ignored a ton, but frontal plane probably even more so. So this is very, very important when dealing with back issues, and this is called side glides. Now, there's a lot of ways to do side glides: against the wall, on the ground, planks are a type of side glide. We're going to show you a very low level one, again, to be consistent with what you're probably going to be able to do and feel in this stage. And that's called the I Dream of Jeannie side glides. If you know what I'm talking about, then you will probably benefit from these. And this is hands together. And you're going to try to keep those hands relatively stable or not moving. And what moves is your pelvis underneath of them. And that creates the left and right or side motion for your back. Now, one of these motions is almost guaranteed to grab you and give you a jolt. Here's the kicker, though. You want to gently go into that motion that is bugging you. And the more you do it, the better it should feel. And it should be very slow, gentle movements, because slow is less threatening. If you do these fast, and if you go completely into end ranges every single time, you're introducing more threat. And more threat equals more pain and more inflammation for your system. So nice and gentle until you start to feel some of that discomfort, and then back and then into it again. Little by little, these will help to calm down that nervous system in the early stages of low back pain. All right, and there you have it, some low level. Now, these are not going to feel low level if you're in an acute flare-up of low back pain. These are going to feel like intense workouts, even a couple of these motions. So if you're watching this and you're like, oh, wow, those are really simple, give them a try. They'll probably feel great for your back, even without any issues. But if you just had a spasm or you just had a low back flare up, or if you just happen to have it for the first time, which is incredibly terrifying, some of these will be lifesavers as your body deals with the inflammatory process. Remember, your body is dealing with it naturally. Inflammation is a normal part of this process. And we talked a lot about this on the podcast. So if you haven't listened to that yet, head over to Movement is Medicine podcast on iTunes, Spotify, Audible, whatever platform that exists for audio. We're probably there. So head over there or the link below. And you can listen to more detail how we talk about acute low back pain. In future videos, we will deal with chronic back pain. So if you've been dealing with back pain for months and years or persistent back pain, we'll show you some things how you can gradually load your back. Because one of the things that happens after you have your first bout of back pain is you start to avoid things. You're fearful of aggravating it and it happening again, and you start the snowball process of doing less and less and less, and then inevitably it happens again. So we'll show you in how to deal with persistent back pain for months and how to load that system properly and effectively in our future videos. So subscribe for more. Make sure you don't miss that chronic low back pain content, and we'll continue to put stuff out similar to this. If there's something you want to see, leave a comment below. Let us know things that you're dealing with, things that have worked for you and that haven't worked for you that you would like us to go over in more detail. We'll catch you again on the next video from Recharge.